Hello, I'm Dr. Wickham Simons. I'm an obesity medicine specialist from the Triangle region of North Carolina, and this is Obesity Medicine Perspective. So if you've been following these videos, you know we've been talking about plateaus and how to get off of plateaus. I was recently at a conference where I heard a lecture that was kind of an update on what's called reward-based eating, and I think this ties into plateaus. So there are a couple types of eating. Generally, the first is you're truly hungry. You actually have a low blood sugar, you're truly hungry, you need something to eat, and so you eat. And that is less of a problem here in the United States because we have an abundance of food. In most Western countries, this is not an issue. The second type of eating is what can be described as rewards-based eating. So you have had enough to eat. It's not that you are truly hungry, but when you eat, it produces a pleasure sensation of some kind. So you crave something, you then eat it, it produces a pleasure sensation in your brain, and this is why you do it. The pleasure sensation is the reward, so we call it reward-based eating. And as you lose more weight, this can become a bigger problem. And when you're on a plateau, a lot of the times you're exhibiting some of this reward-based eating, and in particular during the evening. So you might have gone through the day, worked really hard, feel accomplished, and because you're not the kind of person who's an alcoholic or a drug addict, you don't turn to those things to reward yourself, you turn to some food item. And you look around your place, you say, I desire this, that, or the other, and then you have that thing. And I think it's very important that you try to identify in your life any of this sort of pattern of reward-based eating. So when I talk to patients, I almost always find that this happens during the evening. And it almost creeps in and they don't realize for a while that they're even really doing it. And it doesn't seem like a lot, but it's just enough to keep you on a plateau. So I want you to examine yourself and say, look, am I eating really out of real hunger or out of this kind of reward-based pattern? And if you're eating out of the reward-based pattern, I think you need to start looking for other things that produce the pleasure sensation in your brain and put those in place of eating. And there's lots of different things. But you don't need to reward yourself by the act of eating or drinking some item. And when you're on a plateau and your weight doesn't want to go down, I think you need to really strictly examine what you're doing and just make sure that this pattern is not there. If you're having a problem in the evening and this is you're having a hard time controlling this, you've identified this pattern in yourself, at your next office visit, let us know. Maybe there's some medicine that we can recommend to you that would help you during the evening hours overcome this. So until we talk the next time, we'll give you the tools, you give us the effort, and together we'll overcome obesity.